The superior mesenteric runs out through those mesenteries to nourish the small intestine. And then the third one is called the inferior mesenteric, and it supplies the colon, the last part of the colon here. Going back up top again, you've got your aorta is coming around here, and off the arch of the aorta there are three branches. And this is the one I wrote on the wall up here. We used to call, the first one is called the innominate artery or the brachiocephalic trunk. Now brachio means arm, cephalic means head. So this one on this side is called the brachiocephalic, and it just goes a couple of inches here, and it splits into the common carotid that goes up to this side of the brain, and it goes to and becomes the brachial or the subclavian artery, which goes this way out to the arm. And just so you know, the blood vessels in the arm change names a bunch of times. In the chest, it's called the subclavian. You see it's behind the clavicle. And then once it gets out of goes out between the, above the ribs, it comes out here into the axilla, and we call it the axillary artery here. And then once it gets out here and gets close to the humerus and to the arm bone, we call it the brachial artery, which I'm sure is listed here somewhere, but this is the brachial artery down, there it is, brachial artery. And then the brachial artery comes down and splits into two blood vessels, the radial and the ulnar. The radial goes to the radial side, that's the one you feel your pulse on, and the ulnar is on the other side. That's kind of it. That's 90% of it right there. Here's down the leg. Here's that superficial femoral artery, comes down here and splits into the anterior tibial and the posterior tibial, and then it comes on down here into your foot, and there's the dorsalis pedis artery. And the dorsalis pedis is one you can all feel in your foot. Let me just tell you that it's usually right about here, and if you take your fingers tonight with your socks off, you can usually feel it pretty easily. The thing about the dorsalis pedis is it's very variable. So sometimes it's way over here, and sometimes it's way over here. You just kind of have to feel around until you find it. The posterior tibial here is the one that runs right back here, right behind your medial epicondyle here, your medial malleolus, or whatever it's called. Medial bulge of the bone right there, remember that? Anyway, right behind it, there's another artery, posterior tibial. I think I've said enough about that. The subclavian arteries, when they leave the thoracic cavity, they become the axillary artery. When they get out into the arm, they're called the brachial artery. These are the same artery, it's just different regions of it carry different names. The common carotids go up your neck here. I showed them to you before. They split right here in your neck. Right at this level, you can usually feel the carotid bulb, which is kind of a swelling there. And it splits into the external carotid artery, which goes up and nourishes your face and your tongue and all this stuff out here. And then the internal carotid artery just goes straight up to your brain. Enters the circle of Willis up there, remember that, to carry blood to the brain itself. Three major branches. The ophthalmic artery goes forward to the eye. Anterior cerebral goes up to the anterior part of the cerebrum. Middle cerebral is probably the most important artery for strokes, because that's where most of them occur, is in the middle cerebral artery. Here's a nice picture of that. Here's the common carotid splitting high up here in the neck into the internal carotid, which has no branches. The internal carotid just goes straight up into the circle of Willis up here to supply the brain. The external carotid has a bunch of branches and supplies, everything from the skin out here and your face, and you can see it supplying your jawbone and so forth. The other artery that we mentioned, and we talked about a lot when we were back on the brain, is called the vertebral artery. And you remember the vertebral artery, it comes off of the subclavian here in the chest, and it comes right up here, and remember it goes up through all of those little transverse foramens, the extra hole that's in those cervical vertebrae, not in any of the other vertebrae. It comes up here into the back of the brain, goes up through the foramen magnum, and then the two from either side join together to form the basilar artery, and then that comes up here to join the circle of Willis. So remember, the circle of Willis gets basically two carotids, a big carotid from either side, and two vertebrals from the back. So you have four major blood vessels that supply the blood to your brain. You can see there's lots of other names there. I've cut that down a lot. I've got a list. I think I gave it to you the other day, didn't I? A list of the arteries you need to know. It's on D2L if not. And a lot of these aren't on the list. Just learn the ones that are on the list. I think that'll be all you need to know. This is looking at the base of the brain. I just mentioned it. Here's those two vertebral arteries coming up after they came up through those transverse foramen. They hook up together to form the basilar artery. The basilar artery then enters this thing called the circle of Willis right here. And then you've got your anterior cerebrals, your middle cerebrals, your posterior cerebrals. You've even got some branches that go to your cerebellum here. But that's all pretty easy to see. I think we've talked about this stuff enough. Here's the big three unpaired arteries that you definitely need to know. The celiac trunk, the superior mesenteric, goes to almost the entire small bowel, and then the third one is the inferior mesenteric right here, third unpaired artery, which goes to the colon, the lower part of the colon. Here's the two renal arteries that go to the two kidneys. Here's the adrenal arteries that go to the adrenal gland. Here's the phrenic arteries. The phrenic means diaphragm, right? So you've got a superior phrenic and an inferior phrenic. You will only see the really big ones here on your cats, and that's the only ones we'll be looking to ask you off of the cats. Here's kind of what it looks like with the guts in place. Once again, the celiac trunk here supplies all of these upper organs of the abdomen. The SMA, superior mesenteric artery, you see, supplies about 90% of the small intestine and the right colon. The inferior mesenteric artery right here supplies the left colon and sigmoid colon, and supplies some blood to the upper rectum. That's enough. Obviously, the splenic artery goes to the spleen. The hepatic artery goes to the liver. Wow. I think we've talked enough about the leg arteries already. On your list there, you'll see that there's some, that you don't really have to know any of the names of any of the veins because they're all the same. You know, brachial artery has a brachial vein. Axillary artery has an axillary vein. And that's true of your whole body except for these exceptions right here. There is no jugular artery. There's the carotid artery going up, and there's the jugular veins coming down, so that's one difference. The cephalic, basilic, median cubital, these are really unimportant, but they're in your book. The median cubital is the vein you get your blood drawn out of. It's one that comes across the middle of your cubital space over there. Cephalic and basilic are veins that run up your arm here. I think they're really unimportant. The vena cava, obviously, is the big veins that bring, the inferior vena cava brings blood from the lower part of your body. Superior vena cava brings blood down from the top of your body. There is no vena cava artery. It's called the aorta. You got the aorta carrying blood out, and vena cava bringing it back. So that's another time when there's differences. Saphenous vein, I think, is an important one for you to know because probably 30% of the people in this room will have a cardiac bypass before they're dead. And so you really want to take good care of your saphenous vein. And your saphenous vein runs from right here, and it runs right up here along your leg and comes right up through here and goes right into your groin right there. Saphenous vein is the vein they take out, turn it around backwards, and use it for bypasses, for everything. I mean, for any arterial bypass that you need to have done, you'll usually use your saphenous vein. So take care of it. Don't go injecting anything into it. That would be really stupid.
They'll use the vein to replace the artery?
Yeah. Yeah, and because veins have valves in them, they turn them around backwards. But yes. And veins are really thin-walled. You know, you wouldn't think they were strong enough. But once the blood starts pulsing in them, they get much thicker. And so they're plenty strong. The hepatic veins and the hepatic arteries, they're different, but please don't worry about them. We'll study those in detail when we get to the digestive system. Same with the portal vein. We'll talk about that later as well. Here's the venous system. I don't think I need to talk about it. I've already talked about it. And you should remember your dural sinuses from your brain. Remember you had those superior sagittal veins and the inferior sagittal sinus here. And they came back here and met up with the straight sinus. And they came back to the back, and then they went out laterally through these transverse sinuses and eventually worked their way over into here and joined up with the jugular to go back to the brain. So that's the venous flow out of your brain. Remember, this is called the falx cerebri, and this little one here divides the two lobes of the cerebellum. It's called the falx cerebelli. What a great picture. I love that. I'm going to skip over the portal system for now. This is another set of veins that your body has that basically, instead of taking the blood straight back to the heart, for your intestines, we collect the blood in this vein here called the portal vein, and we take all the blood from all of the guts and send it straight to the liver, where it can be processed. We'll talk about that a lot more later. And then I'll talk about maternal circulation when we get over there. The rest of the chapter, you can look over those slides, but they don't really say very much. Okay, we'll call it good. I'll see you in lab. We'll have a little quiz. I'll talk about the miracle of birth. Hans.